I have a list of so many countries where people are signed in from. It's really exciting. So I want to say hello to various countries represented. Of course, we've got Canada and the US, Ireland, Bulgaria, India, Australia, New Zealand, Kosovo, England, Greece, Turkey. If I missed your country, please include yourself in this warm international welcome, and know that we really appreciate you being here and getting this very important information. Just a piece of housekeeping. This webinar will be recorded and sent out after, so you can review the information again. That way you can focus on and listen completely to the webinar tonight. And now I want to introduce you to the person who's going to be leading your webinar, and that is Alexander Mostovoy. Alexander is a clinician, writer, researcher, and public speaker, and he's recognized as a leading authority on breast health and cancer prevention. After practicing homeopathic medicine for over 20 years, he is now devoting his full time to medical thermography. He's lectured extensively across Canada, the United States, South America, and Europe, and has educated and trained physicians in breast cancer prevention and the use of medical thermography. He is the best-selling author of the book, Breast Cancer is a Preventable Disease, and a co-creator of the 2016 Breast Cancer Prevention Global Virtual Conference. So without further ado, I'd like to hand it over to Alexander Mostovoy and have a great webinar.
Thank you, Tally. I'm also very honored to have so many people on today. We had quite a record-breaking last week. I'm sure we'll have one this week as well. The subject of breast cancer, as you know, is quite emotional. I think many of us either have family members, or we have friends, or we have personal history. I think that by now, probably almost everyone who is listening and watching this webinar today somehow has been affected by breast cancer. So in doing 3 different parts, obviously we can talk about this every Monday night, but time is limited. In doing these 3 different parts, I decided to kind of summarize things and to give the most important things when it comes to breast cancer, specifically to breast cancer prevention. Because we live in a world of fear, and the world of fear is not really conducive to prevention. I think it actually takes the power out of our hands and demoralizes us. So last week we were talking about the brain, the emotional connection to breast cancer. We were talking about carcinogenic personality. We were talking about different hormones that play in that kind of cascade of stress and how that affects us. Today, we're going to be talking about probably one of my favorite subjects, actually, and that is, we're going to be talking about hormones. Now, hormones is a huge subject, and in preparing for this particular webinar, I had way too much information. And as I promised, I'm trying to kind of distill this into a very relatively short 1-hour episode, but to also give you kind of the taste and the essence. So without further ado, let's just dive in. Hormones are chemical messengers that control and regulate most major bodily functions, from hunger, stress, mood, emotions, and reproduction. And I'd like to see hormones as an orchestra. In other words, each and every player has their role to play. And just like in an orchestra, we have different sections, we have different instruments. They all have to play, hopefully, the same score. Otherwise, they're not going to be making music, they'll be making noise, and they all have to follow the lead. So to me, the conductor is hypothalamus, and then the string section, and then the brass section. Of course, what I'm going to do is kind of try at the end of this hour to present you a picture how everything is interrelated and how they all have to play together. So there are endocrine organs and hormones, and we'll start with the brain, of course. We'll start with pituitary gland that produces melatonin, hypothalamus, as I just said, pineal gland. Sorry, I said pituitary melatonin. I got that mixed up with pineal gland. We also have digestive system, the heart, pancreas, testicles in men, ovaries in women, kidneys, adrenal glands, thymus, and thyroid. So all that is an orchestra in play. And I'm going to introduce the principal players because obviously time is limited and we can't really touch upon all of the players that are playing in this particular orchestra. So I will introduce the major ones. The ones that are kind of playing secondary roles, I decided to exclude for the purpose of today's presentation. So we're going to be looking at estrogen and progesterone. We're going to be looking at testosterone, thyroid, with its components of hormones such as thyroid stimulating hormone, T3, T4, cortisol, which we touched upon last week, DHEA, insulin, leptin, adiponectin, and finally melatonin. As I said, this is not a complete list, but for the purpose of today's kind of webinar, I think it will give you an introduction at least on how the hormonal kind of symphony plays it out. So first we'll start with cortisol because we touched upon cortisol in our last presentation when cortisol, of course, is the primary stress hormone. We were talking about stress last time. And it's produced by the adrenal glands. It regulates and changes that occur in the body in response to stress. So the main actions are energy metabolism, blood sugar levels, immune function, and blood pressure. And remember, just like last time, we were talking about cortisol being produced due to stress. So whether it's something that you think about or whether you are under attack, whether you're in a good mood or a bad mood, whether you're anxious, all that is going to affect your cortisol production. So excess cortisol may lead to things like high blood pressure, high blood sugar, water retention, digestive problems, anxiety, decreased sex drive, difficulty losing weight, and finally even insomnia. And here you see an illustration that I decided to present where on one hand, on your left side, you will see different symptoms. On the right side of your screen, you will see how they present themselves. In other words, someone with excess cortisol may even grow a hump on their back, which is kind of a fatty deposit. They'll be more likely to be prone to osteoporosis. They may have hypertension. Most likely they will be obese, and that particular kind of fat distribution is going to be in and around their waistline, and so on and so forth. These people may suffer from different things, and without kind of going into details, you can see for yourself that this is not really a healthy picture. So deficiency in cortisol, as the opposite, may lead to chronic fatigue, muscle weakness, decreased sex drive, low blood sugar, lightheadedness, depression, decreased ability to cope. Now, for the most part, most of us are dealing with excess cortisol rather than deficiency, although in some cases there is deficiency in cortisol as well. Now, DHEA is kind of the opposite of cortisol, and it's a hormone that is in reverse kind of relationship to cortisol. High DHEA will suppress cortisol, and therefore DHEA is also critical in all sorts of hormonal benefits. It's a precursor to androgens, which are male hormones, and estrogens, which are female hormones. As you can see, it will also affect sexual function, body composition, bone metabolism, immune response, and so on and so forth. It's actually quite abundant in our bodies. Thyroid, the main actions is energy, heart rate, body weight, muscle strength, body temperature, menstrual cycles, and finally even cholesterol levels. Again, this is not a complete list, but just to give you kind of an introduction to our main players in our symphony orchestra. Now, you may have hypothyroid, or you may have hypo meaning underfunction, and hyper meaning overfunctioning. So there are symptoms on your left-hand side with hypofunctioning, such as dry and coarse hair, especially loss of eyebrow hair. It's quite a common symptom with hypothyroid. Puffy face, enlarged thyroid, in other words, goiter, slow heartbeat, arthritis, cold intolerance, depression, dry skin, fatigue, forgetfulness. The memory doesn't really work that well, and the recall doesn't work that well. These people usually are kind of will be searching for words or searching for especially for names. Infertility, muscle aches, of course, weight gain will go with that, constipation, and brittle nails. Now, the opposite of these will be on the right-hand side with someone who has hyperfunctioning thyroid. In my experience, I find that probably up to 40% of perimenopausal and menopausal women will suffer from hypo or low functioning thyroid dysfunction. And here are the symptoms that specific that as we're looking at hypothyroidism, here are the symptoms again: dry and coarse skin, constipation, cold extremities, even carpal tunnel syndrome is related to hypothyroidism, infertility, heavy menstrual periods, and so on and so forth. Weight gain, poor memory, something that we just discussed a minute ago. So I'd like you to memorize this kind of picture, because we see people with all these symptoms, and yet just because their thyroid stimulating hormone, or TSH, blood test comes back as normal, their symptoms are, I'm afraid to say, generally ignored, and nothing is being done. So let me say that the way we test for thyroid is grossly insufficient. You should be checking TSH, you should be checking T4 as well as T3, free T4 and free T4 as well as reverse T3. You should also be checking for thyroid antibodies. And not just thyroid alone, you should be checking for adrenal function, and you should be checking for other hormones, specifically sex hormones, that may be interfering with your thyroid production as well as thyroid cofactors such as zinc and selenium that help thyroid convert kind of inactive to active thyroid hormone. So we'll come back to that in a minute. Another player in our orchestra is estrogen or estrogens. There are a few, and we'll go over them. They are produced by the ovaries, by the adrenal glands post-menopause, and in pre-puberty, adrenal glands also produce estrogens. And estrogens are also produced by fat cells as well. Very important factor to remember. So the main actions of estrogen, well, first of all, in the brain, it will help maintain the body temperature. It helps against memory loss. In the breast, of course, it stimulates the development of the breast. And and prepares the glands for milk production. In the heart, it regulates production of cholesterol. In ovaries, it stimulates the maturation. It stimulates the start of a woman's cycle. In the uterus, again, it has to do with developing a fetus or involved in the cycle. The same thing. It involved in the vagina with lubrication and keeping the thickness of the vaginal lining, as well as the bones. It helps with bone density as well. Now, of course, there are many other factors to estrogen, but again, for our purposes, let's just stick to these. Now, there are three major estrogens. One is called estrone, the other one is called estradiol, and the third one is called estriol. Now, the estrone is a fairly potent estrogen, and you'll see why. It's produced by the body fat after menopause, and it has a strong association with breast cancer. Estradiol is actually the strongest of estrogens, definitely associated with breast cancer, and it is the most commonly prescribed estrogen. When we start talking about hormone replacement therapy, you will see. And finally, estriol, which is the weakest estrogen. It's actually cancer protective. It's produced more during pregnancy. As a matter of fact, as a woman gets pregnant, the estriol levels just skyrocket to over 800% of the initial value, and it supports vaginal health. So estriol is the most cancer protective of estrogens. And you will see here, everything, of course, has to work in concert. Estrone, estradiol, and estriol. And this is the ratio of all these three estrogens naturally occurring in your body. 10%, 10%, and 80%. Okay? Now, estriol, as I mentioned, is the weakest, but at the same time, I believe this is actually its strength. So it helps relieve menopausal symptoms, it helps with bone and urinary tract health, it helps with cardiovascular health, and as I said, it's cancer protective. Remember, it's the hormone of pregnancy. And I strongly believe that it has to be used for, and in some cases it is, of course, with hormone replacement or as an additive to women who are low on estrogen. How does this interconnect? Well, remember, our adrenals are producing cortisol. So suppose our adrenals are under stress, right? Of course, the adrenals are not under stress, you're under stress, but the adrenals are taking that load. The adrenals are producing cortisol that blocks thyroid production. And as your thyroid production is blocked, not completely, but it's hypofunctioning, it leads to estrogen dominance. And at the same time, the more estrogen dominant you are and the more estrogen you have, the more it blocks your thyroid production. At the same time, as your adrenals are producing more cortisol, it robs you of your progesterone, which we'll come to in a minute, and depletes that. So you can see how everything is really interconnected. Let me take another minute and I will explain this vicious cycle again. So excess estrogen suppresses thyroid function. That leads to weight gain and adipose tissue, which is another fancy word for fat, right? The more fat you have, the more estrogen you will produce, and the more suppression of the thyroid's function. And it goes on and on and on. So that's why it's very important to understand things that they actually play in concert. So progesterone, which I just mentioned, also produced by ovaries and adrenal glands. And the main actions of progesterones are it balances the effects of estrogen. It sort of has this yin and yang relationship where estrogen is the hormone of growth. Progesterone says, hold on a second, and we're not sure, let's just keep things under control. Let's not just grow indefinitely. It regulates the menstrual cycle. It sustains the pregnancy. It promotes energy production. It actually burns fat, and it's anti-anxiety. And you will see here the effects of estrogen versus the effects of progesterone. So as I said, think of this as a yin and yang relationship. So estrogen builds up uterine lining, progesterone maintains the uterine lining, and during the kind of just premenstrually, it scrapes the uterine lining and creates that menstrual flow. Increases the body fat, estrogen, whereas progesterone helps use body fat for energy. Estrogen could lead to depression, excess, headaches, migraines. Progesterone is antidepressant. Estrogen interferes with thyroid hormone, whereas progesterone facilitates thyroid hormone action. Again, estrogen increases blood clotting, progesterone normalizes blood clotting. Estrogen decreases libido, progesterone restores libido. In other words, again, estrogen impairs blood sugar control, progesterone regulates blood sugar levels. And finally, estrogen increases endometrial and the risk for breast cancer, whereas progesterone actually decreases the risk for endometrium and very much so of breast cancer as well. But you can see that it also has to be in balance. For the most part, in today's day and age, because of the environmental factors, because of our diets, because of our industrial pollutants, because of the xenoestrogens, because of our plastics and our meats and everything else that are loaded with estrogens, most of us are in the estrogen dominant state. So that balance is kind of lost. Now, here I'm going to show you I'm using this slide to show you progesterone deficiency. You will see here, for instance, here's our estrogen and here's our progesterone. So progesterone is almost a flat line up to ovulation. As the ovulation occurs, and if there is impregnation, then progesterone will hold on and continue to rise and maintain that pregnancy. But assuming that there is no impregnation and there is no pregnancy, the progesterone will meet with estrogen somewhere between days 18 to 21. And in a healthy environment, it will go over the estrogen line, and then it will drop just prior to another cycle starting, creating that menstrual flow, as I said, scraping the lining of the uterus, and that's a healthy cycle. However, when someone is progesterone deficient, the progesterone line does not go over the estrogen line. It's actually under the estrogen line. And you will see all the symptoms in a minute. What this diagram is showing you is what is going to cause things like anxiety, mood swings, weight gain, insomnia, bloating, fatigue, low libido, endometriosis, polycystic ovarian syndrome, hot flashes, painful or lumpy breasts, early miscarriage, I think I just explained why, memory lapses, foggy thinking, and PMS. And if you think of the premenstrual symptom, which could be a combination of many things that we just noticed here, like mood swings and anxiety and a few other things, what exactly is PMS is usually estrogen dominance and progesterone deficiency. And speaking about estrogen dominance, these are the symptoms that the estrogen dominance is going to kind of facilitate. We're looking at endometriosis, irregular periods, cellulite, infertility, thyroid nodules, breast lumps, fibroids and ovarian cysts, and finally, as I said, PMS. So This is very important kind of thing to understand because, again, when we're looking at balance, when things are in balance, none of this should occur. When things are out of balance, then we start getting symptoms. This is not a disease. This is a symptom of estrogen dominance. So causes, again, it's a two-way street. Obesity, oral contraceptives, industrial livestock, foods containing pesticides, industrial solvents, synthetic HRT, we'll come back to that. Excuse me. Stress, reduced progesterone input, okay? Trans fats, toxic household products, sugar, fast food, processed food, including vitamin B6 and magnesium deficiency. And just to illustrate the point more, pictorially, as I said, causes of estrogen dominance, one of the main causes, of course, is stress. GMO products, tap water contains estrogen today, shampoos, creams, milk and plastics, factory farmed meat, and poultry that's injected with growth hormones, antibiotics, and all sorts of other nasty things. And even our grains may also contain estrogenic effects. Let's talk about testosterone for a minute as we're coming to kind of to the end of our introducing our main players. Testosterone is usually noted as the hormone of, it's a sexual hormone, right? And that's true. However, I like to see testosterone as a hormone of ambition. And I like to say that nothing would exist in this world without testosterone, because if you have ambition, you want to do things, you want to create things. And if you don't have ambition, or you may be low on testosterone, then the opposite happens. You kind of become less ambitious, let's say. Muscle mass, it also depends on testosterone. It actually decreases body fat, protects against heart disease, enhances cognitive function. So again, there are two conditions here. We're looking at low testosterone and high testosterone. Again, most people with hormonal kind of imbalance most likely will be in the low testosterone category. And they will be suffering, or maybe suffering, from depression and anxiety, low energy, loss of muscle mass, memory loss, weight gain, thinning skin, low libido, and high cholesterol. Now, on the other end of this, with high testosterone, you'll have excessive energy. I remember being a teenager when you had oily skin and acne. Well, that may be high testosterone again. Hair growth, especially with women, if they have high testosterone, most likely that's hydroxytestosterone. PCOS, polycystic ovarian syndrome, depression, anxiety, difficulty falling asleep. You're a little too wired. Now, speaking about or low testosterone, I should say, here's a little bit of a comic relief. After a 2-year loan to the United States, Michelangelo's David is being returned to Italy, finally. Now, our proud sponsors here are McDonald's, Starbucks, and Burger King. So again, on your left, you have a normal person with balanced hormones. On your right, you guessed it, that's a person with low testosterone. Let's talk about obesity, because it kind of plays into weight gain. So I want to introduce a couple of other supporting kind of cast members here. Leptin, a hormone predominantly made by adipose or fat cells that helps regulate energy balance by inhibiting hunger. And adiponectin, a protein hormone made by fat cells that regulates the metabolism of lipids and glucose, influences the body's response to insulin, and has anti-inflammatory effects on cells lining the wall of blood vessels. And here's the thing, that in the ratio, so if your leptin versus adiponectin ratio is high, the risk for breast cancer is also high. And you can check that. So speaking about obesity, not everyone who is overweight kind of has equal kind of amount of risk. In other words, it all depends on how you carry your weight. And that's the old kind of version of apple versus pear shape. So apples will carry a lot of weight above their waist, whereas pears will carry a lot of weight below their waist. And it's distribution of that fat or weight that makes a difference. In other words, apples are much more at risk for cardiovascular disease and cancer, less so with someone who is pear-shaped. Now, remember that also testosterone converts to estrogen in fat cells. Also, testosterone, if you're a coffee drinker, testosterone will convert from testosterone to estradiol, if you remember, one of the cancer-prolific hormones. Women with dense breasts on imaging also is a high risk factor. We'll come back to that shortly. So how hormones make you fat? Let's kind of summarize what we just learned together. Remember that high cortisol, whether it's stress or a prolonged illness, will affect the way your thyroid is working. Your leptin, we were just talking about, versus adiponectin is very important. Your high estrogen will in turn suppress your thyroid, and therefore, as your thyroid is hypofunctioning, you will start gaining more weight. You will also have likely low growth hormone and an imbalanced testosterone, and you will also likely have high insulin. And that's how someone actually starts gaining weight. So it's not just a matter of diet. Sometimes, as in the case here presented, really is a hormonal imbalance. Diet can certainly affect this, and we'll look at this next week. But if your hormones are out of whack, there's absolutely no way you can correct that unless you can correct this imbalance. So speaking about thyroid, here's an interesting statistic that people that have thyroid disorders are 233% higher risk for breast cancer. Women under the age of 45, risk is 4 times higher, which is still huge. And finally, high T4, which we'll come to in a minute, high T4 levels, and usually women on kind of synthetic thyroid medication are given T4. High T4 levels also lead to higher risk for breast cancer. So what I'm suggesting is definitely check your thyroid because hypothyroidism precedes most breast disease. Most thyroid conditions start during perimenopausal and menopausal stage. So women are several times more likely to deal with thyroid issues than men. Remember, TSH levels less than 1 and over 2 combined with clinical symptoms means there's something that's going on. And T3 and T4, iodine and selenium are definitely cofactors, as well as zinc, to thyroid metabolism. In many instances, especially since I live in the so-called goiter belt in the area of the Great Lakes region, we're looking at many people who are iodine deficient. And that's implicated in fibrocystic breast and low functioning thyroid. And there's a whole cascade that thyroid is very important. Iodine is very important. Basal body temperature. In other words, there's a thing called Wilson's thyroid syndrome. So you may come back with so-called normal thyroid blood results. As I said, it's very likely that the testing is not sufficient. And yet you may still have kind of cardinal symptoms of hypothyroid. Inability to lose weight, kind of cold extremities, inability to deal with cold, and so on and so forth. So I can suggest to you, take your body temperature, get yourself a thermometer, and as you wake up in the morning, make sure that before your feet touch the ground, take your temperature with the auxiliary thermometer. If your temperature is below 36.2 degrees Celsius consistently over 3 days, or you can take 3-day measurements and then get an average, you most likely have Wilson thyroid syndrome. And in that case, again, talk to someone, talk to a professional, or look into iodine supplementation as well. Thyroid saliva testing could be utilized. I prefer probably urine 24-hour collection. I think we can get more out of this. And again, we'll cover this shortly. Melatonin. Can't say enough good things about melatonin. Melatonin basically is produced as you sleep. Now, a lot of people may go to bed very, very late, and they're missing out. If you are not sleeping between midnight and 2 a.m., that's where your melatonin production peaks. So if you're going to sleep, let's say at 2 o'clock onwards, that doesn't work. And melatonin is very important because it actually blocks estrogen. It blocks angiogenesis. Angiogenesis is the early formation of blood vessels that also creates potential risk for breast cancer. It inhibits aromatase effect. Aromatase is not aromatic agent that you want to put into your soup. Aromatase is an effect where, let's say, testosterone is converted to estrogen, or different estrogens are actually converted from good to bad. That's called an aromatase effect. It increases that adiponectin. Remember with the ratio. And it actually decreases glucose and decreases insulin resistance. So melatonin is a very, very important thing. And as we age, our production of melatonin naturally declines, as our production of all hormones naturally decline. And I believe that low melatonin level, as well as low DHEA levels, are definitely leading to kind of a much faster kind of aging process. So here is an illustration of cortisol, which we spoke to in the beginning of this webinar, and melatonin. And those two actually have an inverse reaction, if you wish. So let's follow the cortisol level first. Cortisol level here rises just before you wake up. Okay, assuming that you're waking up, let's say about 6, 7 o'clock, then it continues to rise, and cortisol will continue to be fairly high in the morning. By mid-afternoon, it will start declining, and by about 9, 10 o'clock, it will probably be very low. That's, by the way, a normal cortisol line. It's a healthy one. So 9, 10 o'clock at night, you will start feeling like you really need to go to bed. It will continue to be low as you're sleeping. And then again, the following morning, it will start rising just before you wake up. Now, melatonin, on the other hand, is, you can see, it's basically a flat line all through the day. And then melatonin will start rising when it becomes dark. And it's, as I said, it's in reverse kind of connection to your cortisol level. So why am I showing you all this? Is because if you're going to sleep early, or if you're going to sleep late, you're missing out on that melatonin production, which is very important. If your cortisol levels are out of whack, then you're not going to be sleepy enough at 9, 10 o'clock at night to be able to go to bed. So it's important to check your cortisol as well as your melatonin and see how they interact together. It's very, very important. Something else, prolactin. We have women, let's say, that will come with nipple discharge. Usually that's a high level of prolactin, unless it's something else. And prolactin, high prolactin levels definitely act like estrogen dominance. Just a warning that antipsychotics increase prolactin levels. Antipsychotics also increase estrogen levels as well. Insulin growth factor promotes breast cancer. It's a marker for diabetes. So you can see diabetes, obesity, everything has to be in balance. You know, the more weight you have, the more likely you may develop diabetes. But luckily, IGF-1 is modulated by exercise. And a lot of diabetics know this, that they really need to exercise on a daily basis to keep their blood sugar kind of under control. Hemoglobin A1C is another diabetic marker, but with a high level of hemoglobin A1C, you're looking at reduced breast cancer survival. Again, diabetes, cardiovascular disease, obviously is not going to help in terms of survival. Insulin promotes conversion of testosterone to estrogen. It promotes breast cancer growth as well. So when we talk about all this, I want to kind of bring us back to where we started, that breast cancer awareness is really not prevention. Awareness is just waiting for the worst diagnosis of your life. So to empower you, I want to talk about a few things. What can you do about all this? Since last webinar, we received quite a few emails, but I chose this one specifically, and I want to address. So thank you, Amber, for sending me your email. I hope you don't mind. I just kind of printed that and put it up for everyone. Obviously, no one knows who you are other than your name, but thank you. Here, I would like to submit a question for your upcoming breast health webinar. If one has very fibrocystic breast, what is the best way to monitor all the breast changes? How do you tell the difference between fibrocystic lumps versus cancerous lumps? I'm in my late 30s and my breasts are becoming very fibrocystic and seem to change almost daily. I have a history of breast cancer in my family and I'm concerned about these changes. They're hard to monitor because there are so many lumps, and they seem to come and go with hormonal changes over the month. Doctor, of course, recommends mammogram. I have had ultrasound only, as well as thermography in the past. So again, thank you for bringing this up, because that's exactly what we're going to do to put things together, how fibrocystic breast is really most likely an estrogen dominant kind of condition. Before we do that, I want to kind of warn everyone who is on synthetic HRT or hormone replacement not to not to take this lightly. Usually it's Premarin that's used, which is horse's estrogen, that is 8 times as potent as natural estrogen. Provera has 150 listed side effects in the body. And finally, synthetic HRT increases the risk of breast cancer. Bioidentical hormones are safe. And having said that, a lot of people will say, well, what's the difference between synthetic and bioidentical? It's the same molecule. If you look at the bottom of your screen here, you will see natural progesterone, the chemical, as well as synthetic. And anyone who is going to say that it's the same, obviously can see well. So it's not the same. It works under a lock and key mechanism. So yes, it does come in, but it also needs to come out. And if it comes in and doesn't come out, then it gives you a different message. So avoid definitely birth control pills. The single greatest risk factor for future development of breast cancer is lifetime exposure to estrogens. Controlling the influence of estrogen on the breast would be the single most important method of primary breast cancer prevention. I should have underlined this. So breast cancer and birth control pills contain 7 times the amount of estrogen naturally occurring in your body. If you do it once, if you do it over a couple of months, if you do it over a couple of years, there are a lot of studies that will say that after a couple of cycles, you basically go back to normal. I wish this was so. I believe there is a cumulative effect over many years, but it's to your discretion. Obviously, I encourage everyone not to even start. So limit also exposure to xenoestrogens. These could be antiperspirants, cleaning products, and even synthetic hair dye. Has been implicated in one study that 1 in 5 cases of non-Hodgkin's lymphoma was attributed to synthetic hair dye. And again, if you look at the bottom of your screen, here is your estrogen coming into the estrogen receptor. Okay, it binds to the receptor and gives that message. Remember, hormones are messengers. And here is the xenoestrogen that also binds into the estrogen receptor. But the xenoestrogen, usually the message is different from natural occurring estrogen. Usually it's way more potent, and therefore it gives a different signal. And that's a very important concept to understand. So to quote a very good friend of mine, someone who I have learned a lot from about hormones, and not just hormones, general medicine as well, my dear friend Dr. Alvin Peddle says this: the human body should have only the hormones it recognizes, and also knows how to use and remove from the body. So it's not just using them, it's also removing them from the body. I think it's very important to understand this. So coming back to Amber's question, first of all, over 50% of women suffer from fibrocystic breast condition. I don't want to call it a disease. It's fairly common in younger women, and usually as a result of hormonal changes. Okay, so on the right side of your screen, you will see a fibroadenoma, and a little further, you'll see cystic or cysts. And cysts are simply fluid-filled sacs. Now, there may be fibrous or firm rubbery, such as in fibroadenoma, or cysts, which are, as I said, fluid-filled sacs. They expand and they shrink under the hormonal influence. So that's why premenstrually, as these cysts expand, usually there's discomfort because they're bigger and they're pressing on the surrounding tissue. Common symptoms: breast swelling or thickening, lumps, pain, tenderness, aching or sharp pain, burning and itching. Obviously, women that are suffering from fibrocystic breast disease know this very well. Testing for fibrocystic breast, ultrasound is the most appropriate test. Mammography is not specific for fibrocystic or dense breast. It just isn't. And thermography could also be used for risk assessment and follow-up. And I'll show you in a minute how you can do that. So there are advantages and disadvantages to all tests. For instance, the advantage of an ultrasound is that it emits no radiation. It's more specific to fibrocystic or dense breast. It actually differentiates between fluid-filled and dense mass. So if it's regular shape, most likely it's a cyst. If it's irregular shape, then it's most likely someone is going to get suspicious and escalate that, most likely to mammogram and maybe other tests. And it can image non-palpable masses. It's safe for pregnant as well as women with breast implants. Disadvantages, it doesn't really go all the way. It doesn't really go very, very deep. And it may not distinguish between abnormal and surrounding tissue. It is operator dependent. Training and experience is very, very important. And finally, unlike a mammogram, it doesn't pick up microcalcifications, which is considered to be a precancerous condition. I don't think it's such a huge risk, and maybe we can cover that next week when we're talking about calcium. But that's definitely a calcium deposit. So thermography could also be used as a treatment monitoring. In other words, on your left side of your screen, you see someone that has a lot of vascular activity, whereas on the right-hand side, same person, not so much vascular activity, difference in temperatures. And this was done simply with 6 months of indole 3-carbinol supplementation. Very inexpensive, non-threatening, but what indole 3-carbinol does, it helps regulate your estrogen metabolism. Obviously, someone like that has been, or maybe still is, estrogen dominant, but with a small kind of supplement over the counter, that was regulated fairly quickly. The conventional treatment of fibrocystic breast is needle aspiration of cysts. So it's fairly discomforting. It is definitely invasive. And usually as you aspirate the cyst, you really didn't address the underlying cause. You're just going after the symptom. And if there is a cause that hasn't been addressed, the symptom is going to persist. Not only the symptom is going to persist, but it most likely the body will decide to create more cysts. So that's not something that I would recommend. Now, as I said, address the cause, not the symptom. So when it comes to fibrocystic breast, you're most likely looking at hormone imbalance, which is #1 contributing factor. You may have elevated prolactin levels. You may have growth hormone imbalance, insulin resistance, thyroid dysfunction, as I mentioned before, especially iodine on a low level. And there may be other kind of factors like environmental, dietary, and metabolic toxins. So when we talk about disease, we're talking about deficiency, lack of something, or lack of nutrients, for instance. We're talking about enervation, which is lack of energy. And we're talking about toxemia, which are, let's say, environmental or other toxins that are kind of having an interplay with all this. And that causes this condition or disease. So for prevention of fibrocystic breast, I would strongly suggest, Amber, that you do self-breast examination on a monthly basis. Choose a day, usually maybe between day 7 to 10 of your cycle. And if you already know that you have atypical hyperplasia, or if you have history of breast cancer in the family, or if you have history of ovarian cancer or prostate cancer, make sure that your doctor examines you, and that's called CBE, or clinical breast exam, every 6 months with the follow-up, just a regular breast exam. And as far as imaging, remember, ultrasound is probably going to be your kind of imaging of choice. Just remember that you want to compare apples to apples and not apples to oranges, because that ultrasound needs to be taken on the same or within the same kind of day of your menstrual cycle. So let's say if you're going on day 10, 3 months or 6 months later, try and go also on day 10, because it will show very, very different things or on day 21 or 25, and then you're comparing where obviously there's going to be more estrogen present, your cysts are going to expand, and they will say, wow, they're growing or they're expanding. You have to compare 2 the same day, to be more accurate. And again, you can also use thermography for kind of risk assessment, as well as to see whether or not your therapy is working. Now, I would strongly advise you, caffeine, in my book, is a big no-no. Anyone who has not only fibrocystic breast, but who has elevated levels or estrogen activity should avoid caffeine. Tea, of course, contains caffeine as well, and alcohol. And why I'm saying this is, just imagine 2 cups of coffee a day will rob you of 60% of your testosterone. And that testosterone is not just going to disappear. Testosterone is going to be converted or aromatized into your estradiol, which is cancer-prolific estrogen. And that's just 2 cups of coffee a day. It will also dehydrate you. It will also leach calcium out of your bones, and on and on. And the same thing goes with alcohol. So I know many of you don't want to hear this, but I have to tell you the way it is. Chocolate also contains certain substances, as well as caffeine, and not on the same level, of course, and definitely avoid soft drinks of any kind. How you would treat that? So first of all, correct your hormonal imbalance. Natural progesterone most likely will be indicated to offset that estrogen imbalance. I would also suggest that you go on anti-estrogenic diet, which we'll cover in detail next week. Low animal fat, low dairy, low glycemic foods. You can also look into supplementing with indole 3-carbinol and or DIM to regulate your estrogen metabolism. As far as vitamins, vitamin A, you can go 20,000 units or higher. Vitamin B6. Vitamin C, you can go 500 milligrams or higher. Vitamin E, so not just vitamin E, but make sure that it's tocotrienol, not just regular tocopherol, but it's tocotrienol as the vitamin E. And finally, vitamin D, you can go 2,000 units and up. I think it's a very, very safe dose. Now, to correct your thyroid dysfunction, look into iodine supplementation with Lugol solution, for instance. Now, why I'm talking about iodine, you can do a loading test. You can search on the internet about iodine loading tests and see how much your body absorbs or retains when you take an iodine pill. And based on that, you can kind of see whether or not you're iodine deficient. Again, I would strongly suggest that you do this with a healthcare professional who's knowledgeable about these things. Unless you have access to them, it's probably not a choice, but definitely do it under the supervision of a healthcare provider. And then magnesium, zinc, Agnus castus, which is Vitex common name, oil of primrose, and castor oil packs. When you really feel that your breasts are burning and very, very painful, castor oil packs usually help. So hormone testing. Balance is more important than individual hormone levels. And remember, that orchestra has to play the same tune and follow the direction of the conductor. Okay, it doesn't really matter if you're, let's say, if your trumpet player decides to play a different tune, bring them back and make sure that we're all in tune here. And timing does matter. As I said, if you're checking for, let's say, steroid hormones like estrogen and progesterone and testosterone, the best way for menstruating women would be to check that with a blood test, for instance, between days of 18 to 21. With postmenopausal women, it doesn't really matter. Just choose a day in the calendar month. And then if you're going to do subsequent testing, and do it more or less on the same day. So timing does matter. Blood or serum test is appropriate for thyroid hormones, for follicular stimulating hormone, for luteinizing hormone, insulin, glucose, prolactin, Vitamin D levels should also be checked, even though it is called vitamin D, it really is a hormone. And however, the blood does not really accurately measure free hormone levels. In other words, it's not just in your blood, but what's in your tissue, on the cellular level. That's what's important as well. Now, saliva, on the other hand, is also good for steroid hormones such as estrogen, progesterone, testosterone, DHEA, and you can take that saliva, let's say, over a period of 24 hours to see how your DHEA and cortisol kind of go up and down as well, and dehydrate testosterone as well. However, saliva does not measure metabolites. It doesn't tell you how you're metabolizing things. And the issue sometimes with saliva tests is that the reference range is not always kind of totally established. It's we're still in the process. Now, finally, probably the optimum is going for urine testing. It's good for hormone and metabolite testing. In other words, what comes in as well as what comes out. It provides really information on detoxification and metabolism of hormones. So you may have normal levels kind of in your blood and in your saliva, and your urine may confirm that, but maybe there's some kind of a block that certain hormones are not leaving your body, right? So they're not metabolizing properly, and then you can figure out what may be blocking this and fix this kind of connection. I want to introduce a couple of very important tests here. And once you start checking your hormones, remember E1, E2, and E3, estrone, estradiol, and estriol. And this particular one is called estrogen quotient. There is a simple mathematical formula that, in a sense, helps you assess your risk for breast cancer. In other words, EQ, or estrogen quotient, equals E3 over the sum of E1 plus E2. So you take your estrone value, you add your estradiol value, and you divide that into estriol, which is E3. So if your EQ is less than 1, your risk for breast cancer is higher than obviously when your EQ is over 1. And ideally, you want to have an EQ quotient of greater than 1. Okay, very simple. Once you get your numbers, you can plug in this formula. Easy stuff. And there's another one also called Estronex test, which again looks at estrone. Now, there are subsets of estrones. For instance, there is a subset of estrone which is E2 and E16. E2 is 2-hydroxyestrone, which is protective, as well as 16-alpha-hydroxyestrone, which is cancer prolific or high risk. And again, if you get your results, you can get 2/16 ratio. If it's less than 2, it may indicate long-term risk for cervical, breast, uterine, prostate, and other estrogen-sensitive cancers. Okay, this is not a one-way street. I need you to understand that you can take certain things, you can change your diet, you can lose weight, you can exercise, you can do all sorts of things, which again we'll discuss next week, to change your ratios and therefore lower your risk on a biochemical level as well. Okay? And just for fun, let's just look at this diagram so we can look at, for instance, arm fat. Well, that may be indicative of high insulin and low DHEA. If you have chest fat, that may be high estrogen, low testosterone. If you have belly fat, that may indicate high insulin, low growth hormone, low or high estrogen, high testosterone, and high cortisol. Remember, people under stress most likely will hold their kind of weight around their waist. Love handles, high insulin, and blood sugar imbalance. And finally, if you have kind of fat distribution in and around your hips, butt, and thigh. That's high estrogen, low progesterone, and low growth hormone. You see how easy things are. So just to kind of have some fun here. So what I want you to take away today is the following. Don't guess. Don't just look at the diagram and say, well, I must have this or I must have that. We just did this just to summarize things. But really, don't guess, test. And you can use blood, you can use saliva, you can use urine. As I said, to me, urine kind of gives you a fuller picture. But it's not always necessary. It depends on what exactly you're looking for, or your healthcare provider is looking for. And consider bioidentical HRT if necessary. In other words, if you are estrogen dominant, if you're lacking progesterone, yes, you can do it with diet, and we'll go over this next week. But you can also take bioidentical progesterone to help yourself kind of balance. So make sure that you find your healthcare provider who is an expert, and I mean an expert in BHRT, bioidentical hormone replacement therapy. That's very important. Not everyone who says they know what they're doing really knows what they're doing, but that's not just in medicine. I think that's in every field. And finally, make sure that you kind of understand how to do your breast assessment, self-breast examinations, clinical breast examinations. You can use thermography or ultrasound and see what fits in so that you understand your risk. And once you understand your risk, try and figure out how to lower your risk because, as I said, if you have high insulin or if you have low progesterone or if you're estrogen dominant, you can balance your hormones. You can get your health kind of into a normal or healthier position and therefore reduce not just breast cancer, reduce cardiovascular disease, reduce everything else, and stay healthy. As I said, it's not a one-way street as we get older that we become sicker. I don't believe in that. So we're almost at the end. As I promised, part 3 next week, next Monday, April 1st. No April 1st jokes, please. Diet and nutrition will take a look at how do we use diet and nutrition for breast cancer prevention. We'll also look specifically at anti-estrogenic and anti-inflammation diet because it's very important. And it's important in terms of balancing your hormones as well. We'll also look how liver detoxifies, specifically for estrogen metabolism. Because as I said, estrogens are implicated in the majority of breast cancers. And finally, we'll also be looking at vitamins, minerals, and supplements that, and I'll take a look at really what works and what doesn't work. Because not everything that's supposedly in your health food store works. So we'll take a look at what needs to work and what actually works. So thank you very much for being with us, with me. I hope that you've got enough information, and I hope that you will come and join us again next week, same time, same channel. Until then, I wish you all good night and best of health.